Anyway, you have brought in this particular term, ORRT. I would like to ask Dr. Mumtaz, can you just elaborate on this particular concept?
Hoping I'm audible.
Yeah.
This obstetric rapid response team. When it is an emergency area or casualty, we all know what type of patients come there. And the team available there is well equipped in, they are well knowledgeable in monitoring these patients, assessing these patients, and managing these patients. But when it comes to labor room is the scene where we think everything is going to be normal. And we are not expecting anything abnormal most of the times. Most of the time, everything goes fine also. But we also know obstetrics is the field of unexpected emergencies. And what happens when an unexpected emergency comes, when we are unprepared, the staff is unprepared, what the outcome is going to be. When the staff is unprepared, we don't have enough drugs or we don't have enough infrastructure or equipment to assess and monitor these things. So like in any emergency, the unpreparedness causes life. That is the problem when we are unexpecting and when we are not prepared for a complication. As we know, in any emergency, the outcome is better only if you identify the problem at the outset or early, and we manage the problem very early. Only then the outcome is better. And when a problem arises, most of the times we don't know whom to call, what to do, whom should we contact, all that. And the answer to this is ORRT, or the Obstetric Rapid Response Team. The basic concept of this is there's a group of people who will be the activators, who have the knowledge of the probable emergencies. These are usually the staff nurses in the labor room or the junior doctors. And they can also get information by closely monitoring these women through the warning signs, looking at the warning signs. And once they know there's an emergency, they have to send an immediate call to the responders. The responders are the ORRT team who will rush to the spot and will do the immediate resuscitation or stabilization of the patient after their initial assessment. And then only the further treatment will be planned. This is an example of the warning sign chart which anybody can use to know whether the patient is in safe zone. And how do the activators call the responders? That communication is very, very important. It has to be quick and it has to be prompt also. Only if the message is conveyed properly, it makes a difference. Otherwise, it doesn't make a difference to the whole process. So communication is very important. It has to be rapid and prompt communication. And once the responders reach the scenario, everything should be available. Only then it will be helpful to save the patient. So how to develop a team is the question that we should ask ourselves. We can train our nursing staff, and we should have a team of clinicians who include the anesthesiologist and also the critical care people. But of course, the obstetrician should be well versed in all this. And always there should be a support from the blood bank and the laboratory also. All team members should be well oriented and trained in managing obstetric emergencies and life support system. And depending upon the availability in each shift, they should be divided into groups, and each team should perform according to their duties given to them. And there should be periodic drills and ongoing programs, training programs, so that that will help the team members to understand what are the common problems that you can anticipate in the labor, and what are all the management protocols that is available for the same. And it also helps them to practice life-saving measures like CPR, endotracheal intubation, etc. And also helps in practicing effective communication in a scenario of crisis. So we all should have ORRT training. We all should train our own staff and our own junior doctors, and all institutions should have an ORRT team to deal with emergencies which we know for sure will occur, but we only don't know when it will occur and how many will be there trained for handling that situation. So it is better that we train ourselves and be prepared and be well equipped for that. That's it.
Okay. Thank you, Dr. Mumtaz, for effectively summarizing this vast topic into a few slides. So the resuscitation must be effective in the shortest possible time, observing protocols. That is very, very important in the salvage of this patient. And irrespective of the level, type of institution, I think all institutions should absorb this particular concept and should have teams ready, all maternity institutions, and leave alone maternity, other institutions also should